And welcome once again to Living in the 21st Century. Joining me today is Dr. Nandini Gokukhandran from NeuroGen Brain and Spine Institute, and that's in India. Thank you, Doctor. It's good to have you on today.
Thank you so much, Mr. Errol. It's good to be on this program, and good evening, everyone.
Thank you. My first question goes out to you. Our Secretary of Health here would have indicated that thianol has adverse effects on pregnant women, that it's the link to autism while in pregnancy. Is there any truth to that?
So let's understand what Tylenol is first. Tylenol is acetaminophen, which is used for fever or pain, common pain in general public. If you have fever, Tylenol is the first course of medicine that is given. And so far, it has been known to be one of the safest drug to be used in pregnancies. So if any pregnant female has a fever, Tylenol or paracetamol or acetaminophen is what would be given. Now, as far as the statement of Robert F. Kennedy, when we look at scientifically, there is no direct scientific evidence that Tylenol is causing or causation of autism. The petition or the statement is currently based on a few previous studies which showed some association of Tylenol with autism. However, there are many who have shown that there is no strong association. In fact, there is a very strong study of about 25 years from Sweden, which was published in 2024, where this group studied 2 million patients and also looked at sibling cohorts and found that there was no strong association between Tylenol and autism. It could be a coincidence because also you have to look at other factors. It could be the fever in the mother causing a possible autism because Tylenol is given generally for fever. So all these other factors need to be taken into account. So as of now, there is the evidence is not strong enough to correlate Tylenol with autism.
Thank you for clarifying that. We want to look at autism in its purest form because one of the things that I've recognized recently, and I'm pretty close to a neighbor she just started an autistic school, and it was a situation where the child were not, I think, accepted back in the school. I'm speaking subject to correction. The stigma, how out of school children look at kids who are autistic, apparently they come across as bullies, they come across as everything but of human nature, and they're often seen as cast out. Could you give some social insight as to why autistic children should be treated with respect, embraced as the next person, just a little bit off in the way they connect socially, but has no complications on a next person?
Absolutely. Absolutely. What you're saying is correct. That for a long time, it was not understood really what autism is, even in developing countries like USA. I'm from India. The awareness is much less. However, the last 15, 20 years, awareness has increased. Inclusivity in school is now very much encouraged, and children are encouraged to be part of a school system which is holistic. However, we find that teachers as well as the other neurotypical students are not yet prepared, or they are not mentally aware about what is a child with autism going through. So there is a campaign about accepting and embracing individuals with autism, understanding that they are neurodiverse. They are not less than anyone. They are neurodiverse. So we have neurotypical and we have neurodiverse. And looking at the numbers of autism now in the US itself, the CDC Atlanta data says 1 in 31 prevalence of autism is 1 in 31. Looking at this data, and hopefully, and looks like in the next 10, 15, 20 years, it could be 1:3. So it is important to understand what autism is, that it is not a disease, it is just a condition of the brain, which is different from others, it is wired from others. And if you look in the history of mankind, you find many individuals with autism doing exemplary work, and in fact many of the things that we are using now are because of these autistic individuals. If you look at contemporary autistic individuals, Elon Musk himself has come out and accepted that he has Asperger's, and he is one responsible for bringing Tesla to us. So we are going into the electrical vehicle, more environment friendly vehicles, just because of an autistic individuals. Bill Gates, who is also one of the richest men in the world, who is the founder of Microsoft, accepts that though he was not diagnosed as autism, he has all the features of autism. And even now, when you look at him, when he does interviews, you can see those different nuances in him which are still there. And he says that he would not change his autism or his specialty for any reason, because that's what helped him to code with focus. So if you look at these individuals, you find, and we have been working with children and individuals with autism last 15, 16 years, and we have find they have amazing abilities. And if we can just harness it, and if we can appreciate that, we will know that they are child prodigies in their own way, and they can lead to a better world. So it's very important that, one, we develop tolerance for people who are different from us, who we may think are less, but actually in many ways are better than us, and that we should be open to them. And I think a lot of this would come from parents. If you want children in the school not to bully the autistic child, or a child who is ADHD, or a child who is a little different, it has to come from the parents. The parents have to be educated, and they have to pass on that empathy of embracing different people, having tolerance for those who are different from us, whether they be black or white, yellow or red, or autistic or ADHD, or tall or short. It has to come from the parents. So awareness in the community is very important.
Absolutely. And I agree with everything you just said there. I used to work in a mental institution on a developmental unit where I had several autistic kids. And the truth is that I found that among these autistic kids, they were so smart. I mean, too smart than the normal Irish kid. They were way ahead of their time, right? And sometimes I ask myself, is it because these people are too smart and not and way advanced of their time that the others think that they're actually crazy when they were not? My only issue is that I found that they were easily triggered to noise. And we had prepared a sensory unit where among that developmental unit, a sensory unit that caters specifically for the autistic group with a Montessori approach, and it seems to work very well. Should you think then in public schools, do you believe it may be very well be good to have a sensory unit established in public schools, may even be in colleges, for who knows, I don't know, that can aid and assist these autism kids to grow and be academically nourished without interference of the normal behavior kids. I don't even want to say that they're abnormal, because in my opinion, the only difference that some of them couldn't stand is the unnecessary outbursts of physical interactions in one way or the other. But otherwise than that, I found in many of them to be very brilliant students.
Yes.
And spiritually also.
Yeah.
Sorry.
Sorry?
Yeah, no, I was saying they were also brilliant spiritually as well.
Brilliant?
No, I'm saying that also the autistic kids that I've worked with, they were also brilliant in spiritual matters.
Is what matters?
Spiritual matters or awareness of the environment.
Yes. So, children, autism basically is a sensory processing disorder, also. So, one of the issues is that they do not process information like we do. So, it could be the information of light or sound or touch or even taste or smell. All these senses sometimes are, either they are hypersensitive, they are hyposensitive. So, if you look at early intervention, it actually focuses on helping children with autism to process their senses better. So yes, sometimes they get triggered by very intense light, or they get triggered by different kind of sound. It may not always be loud sound, but it could be a very different frequency of sound. So yes, those are sometimes deterrents for their becoming part of the general public school forum. So it's good idea definitely to have a sensory room where if they have such a breakdown, they can go and sort of find a way to control themselves, or find a way to reduce their anxieties, and get themselves to a more optimum state, and so that their performance is better. A little support, that's why our understanding from their peers would be really helpful. But a lot of these things, as the child grows and if you do proper intervention, they do understand it. So in many of the schools, they do have a program where they have inclusive education. However, they have different units where children with autism are first made school ready, and then once their behavior and sensory issues are reduced, then they are integrated into the mainstream school bit by bit. So they are first taken into the along with neurotypical children for art school or for sports, so that they become more accustomed to the general noise, or the social interaction improves. And once they are used to it, then the classroom. In the classroom, especially in India now, we have the help of shadow teachers, or in the US they are called teacher assistants. So this assistance will help the child to be able to sit in the class, and also focus better, and help the child to read and write, and that also helps them give a little support from being prevented from being bullied also. So a teacher assistant is a good addition. However, looking at the numbers again, the resources that we have are very limited, and that's where we have in general, the community, or wherever in the world, the government itself is somewhere incapacitated by the lack of resources of having shadow teachers or teacher assistant. Um, so yes, we need to have more of these resources. I think we have to build resources.
Okay. Is autism only a neurological issue, or is it also a spiritual influence?
I didn't get that
Sorry.
last
So
part.
is it just a neurological issue, autism, or is it both
Yeah.
neurological and spiritual?
What does partial mean? I mean,
Well, so
I didn't get your reference to that.
culturally speaking, there are
Social.
those, yeah, and speaking from a cultural standpoint, there are some cultures when children are born autistic, they believe that that person or the parent were demonized in some form, and the children born with multiplicity of different personalities, and then this, as a child grow, they start to, you know where I'm going with this. So
Understand.
clarify
So no,
that.
no. Absolutely, autism is a neurodevelopmental condition. There is no evil, there is no curse, there is no devilry there. It's a neurodevelopmental condition. When the child is in the mother's womb, so there is some sort of an either insult or a lack of oxygen, or some factors which is preventing the brain development. We still don't know all the factors yet, but as the child comes out also, so in the late part of the development of the body, where the brain is developing, as well as the first year or year and a half of the life, is when the autism is actually the where the problem starts. However, of course, we see it only at about 16 to 18 months. So it is a neurodevelopmental condition. There is no curse, there is no rivalry there. As you said, in fact, these children are extremely intelligent. Just their way of processing information is different. We have seen that the children have very good visual spatial understanding, so they're visual learners, so they look at things and they learn. They have photographic memories, they have amazing arithmetic abilities, they can do mental mathematics. So all of this cannot really come from a cursed person, right? So this is pure and absolutely known scientifically as to be a neurodevelopmental condition.
Okay. So I know recently, well, that's like 3 years. The time flies so quickly. But between yourself and Dr. Sharma would have performed worldwide, like over 7,000 surgeries. I mean, probably it's like way up now. When you perform these surgeries, is there a specific area of the body that you target? Obviously, it's the brain, but what actually is going on there to make things better for that child to progress in life?
Right. So overall, as I said, what we are doing is not really surgeries. We do procedures to improve the brain functioning. And we have treated, you would be happy to know, recently about 16,000 patients from all over the world. And these are all different kinds of neurological conditions, including autism and cerebral palsy and intellectual disability and muscular dystrophy, head injuries and spinal cord injuries. About 6,500 or 7,000 of them to be autism. Now, when we study children with autism, we do look at the brain. We do special neuroimaging known as PET-CT scan of the brain, where we look at functioning of the brain. And we do find that it's not the whole brain which is affected. There are specific parts of the brain, which are deeper parts known as the hippocampus or medial temporal, which is important for understanding, for learning, for comprehension, for memory, for socialization, emotional expression, and for speech or language is affected. The part of the brain in which is called the thalamus, which is the relay center of the brain, which connects the two brains to each other and the brain down to the spinal cord. The thalamus is a sensory and motor processing unit of the brain, is functioning less. And also the back part of the brain known as the cerebellum. Now, the cerebellum is like a traffic police of the brain. So whatever the main brain needs to do, the cerebellum will help to execute it. So it is important for fine motor activity, coordination, balance, and articulation. So these are the parts of the brain which are generally affected in children with autism. If you look at the main brain is all good. In fact, when we looked at it temporally, we started from a 2.5-year-old child's brain to a 15, 16, 20-year-old. We found that the younger brain is in fact much better in performance than a normal brain. But with time, the brain functioning is going down. So metabolically, the brain functioning goes down with age, and the deeper parts of the brain, which are typically we call it subcortical areas, are functioning less. And I said the cortex, the main brain, sometimes is functioning more. The back part of the brain, which is the brain for the visual area or the occipital lobe, is in fact functioning much higher than normal. So though there may be some areas which are functioning less, there are areas which are functioning more as well. And we call that the superpower of these children.
Beautiful. I know that India is a place for homeopathic remedies. Is there any kind of homeopathic treatment you ever apply to autistic treatment or anything like that?
No, homeopathy is not our forte. What we do is regenerative medicine or cellular therapy. And this is very much part of modern medicine. So what we are doing is we take the child's own bone marrow, which is currently producing blood from the hip bone, and we separate the special cells known as mononuclear cells, and we inject it into the spinal fluid in the back. And this fluid goes all around the brain and spine, and the cells go to the part of the brain which is functioning less, which I just mentioned. On the PET scan, we see these areas are hypermetabolic. So the cells will go and stimulate these areas to function better. So we find that the areas which are weaknesses are hypermetabolic, are functioning less, get stimulated, so that their strength becomes more and their weaknesses improve. So the child learns better, understands better, is able to process information better. The part of the brain for sensory processing, that is thalamus, is affected. So the thalamus starts functioning better. The cerebellum starts functioning better. So understanding their speech, their ability to communicate, their ability to socialize improves. And after this treatment, when you we have in fact seen many of these geniuses coming out. We have seen children who were not in our world, they were in their own world. We are able to get them out into our world, and we start seeing, see the parents start reporting their sparks. They start saying, I don't know what to do with this child, but he is so obsessed with alphabets, and everywhere he's reading these alphabets. So I said, this is his geniosity. I don't know how, but he knows thousand. He knows 1 to 1,000. I've never taught him. So you start seeing things which you have not taught, because now the child is able to take information from the surrounding, process it in his own way, and is able to get his potential out. That's what we are doing with the treatment at NeuroGen.
Beautiful. At what point or age should a parent look for any signs to see if the kid is a little bit abnormal or starting to develop into being autistic? What are some of the signs she or he could look for?
Conventionally, parents start noticing the child could be a bit different around 16 or 18 months. But if we are alert, there are parents who have started noticing even at 6 months. So the first time parent feel that child is not all right is when they see the other peers start babbling and saying words, but your child between 1.5 is not even trying to say any words. But there are parents who have one child on the spectrum and started noticing that your younger one is also not giving eye contact, is not giving social smile, is sometimes crying all night. Many of these children are very colicky children. They have a lot of gut issues, so they cry all night. They have severe lactose intolerance. Sometimes you have to change the feed. They do not settle easily. They don't sleep well. As I said, they don't give eye contact when you call out to them. They don't, when you give them any kind of sensory information, like even a rattle on the side, they will not look towards you. They may be good for hearing, because many children are even checked for hearing loss early on, but hearing is fine. They will not give you eye contact. So responses generally are slower and very, very finicky children. So that's where you have to start being a bit alert. And I feel that apart from this, very important that you try and avoid too much of contact with the digital medium. So avoid using your phone to entertain your child, because a child who is already a little bit not responsive to you, the responses will become further diminished if you do not give him enough social interaction. So most parents are now using the phone as substitute for themselves, and that prevents the socialization and further enhances the feature of autism. It further enhances the severity of autism. So yeah.
Sorry. Any major, I think this is very important. Is there any major reason why these autistic kids don't like to, I find that's a part of their life. They don't give eye contact. And for the natural human being, when you start not giving eye contact, that's when you get into this process of getting bullying. You look like you're fearing something. Is there any reason why they don't like to establish eye contact with the next person?
Yes. Yes. See, autism, what is autism? Awe is self, autism is body. These children like to be in their own self. They are not very social. They do not like to communicate. They do not like to interact, because they have their own world. Okay. And they do not want to get out of that world. So it is a social communication disorder as well. So it's not that they cannot speak. Sometimes they may be able to read whole paragraphs. Okay. They may be able to sing complete songs. They would be able to memorize things and say, but they will not want to sit and talk to you. So that's why they do not give you eye contact, because they are resistant to having a social communication with you. And even those who have, there is a limited, they have limited eye contact. They don't look at you, not because they also little anxieties are there and maybe a lack of confidence, but also mainly lack of socialization. They do not want to be social, and that is the main hallmark of autism, because you will find a lot of children with intellectual disabilities also delay in their speech, but it's just because their cognitive development is low. But in autism, many a times the cognitive development is above par, but they, even adult individuals who have sort of overcome many of their autistic features and been able to do amazing in life, still do not give you eye contact, because their main issue is they do not want to socialize.
Absolutely. Well, Dr. Nandini, we don't have the last 2 minutes. If there's any final word you would like to say to a mother or a father who have an autistic child and caution them how to best take care of them children, please, you can tell them.
Sure. Those who have children with autism, first of all, do understand that your child is not any less. Your child is just different. Look at your child's positives, look at your child's potential. If you look at your child in a negative way, the child's anxieties will increase and his confidence will go down, his or her. Now, we're seeing a lot of girls also with autism, unlike before. So, very important is to harness their potential, look into the child, love the child. We say, without any condition, and you will find that the child will come out with amazing potential. Remember, your child has a potential to become an Elon Musk or a Bill Gates or a Temple Grandin, or can become an Albert Einstein, if only you have the confidence in your child. So early intervention is very important. Try to get your child to socialize more, take your child out more, don't be defensive. Work on the sensory issues, of course, but work on the gut as well. We at NeuroGen, please do look up our website. We also do a lot of work on the brain functioning of the child and help the child to become better. So most important is, do not give up. If anybody is telling you that you have to live like this all your life, yes, you have to live with hypertension and diabetes also, but you can live the life with joy. So you can live with an autistic individual with a lot of joy and help him become the best person he can in the world.
And on Dr. Nandini, just for 1 second, give your website address.
Sure. Please do reach out to us at neurogenbsi.com, NeuroGenBSI, Brain and Spine Institute, so bsi.com. We are a center of holistic treatment for neurological conditions in Mumbai, in Mumbai of India, with 16 years of experience of neurological conditions and pioneers in treatment of autism. Please do look us up.
Well, thank you. And on that note, Dr. Nandini, it was a pleasure having you on today. And all those who have been tuning in or living in the 21st century, have a great day.